welcome back to part 2 of making the most of your consultation with Stop Fainting snippets. So sometimes, with the best will in the world from both the patient and the clinician, things don't go as well, and we often see patients in our clinic who have said that they've had difficult or distressing encounters with their clinician. Boone, do you have any tips for patients as to what to do if they're sensing that their interaction with their doctor is not going as they would like?
It's a very challenging topic to talk about, but on the other side, as a clinician, what I would say is having a very good initial encounter with the patient so that the read and the feel of that encounter is very positive in the initial first 30 seconds is quite important. So come in, say good morning, how are you? Instead of saying this medication didn't work, why doesn't it work? Would be a nice start, because to set the tone for the encounter as a positive interaction is quite important. And I only say this because we are humans. Doctors are humans, your healthcare professionals are humans, and we undergo stress ourselves. We have a late running clinic, we might have been sleeping late because of a deadline or kids or children. So just like you, everyone around you interacting with you, including the nurses who check you in, are also human. So I think it should go without saying that we like to be treated as such as well. So the interaction should be quite positive. Now, the other side of that coin is when you feel you're just not getting your point across, or that you feel something inappropriate is said to you. And the second trait that I'd like to ask you as a patient to express, which is challenging, I know, is to express forgiveness. Because as I said in the first trait is we are humans, and that means we are also fallible, and we have faults, we have gaps in knowledge, including all of us. If you ask me anything about your big toe or your fingernails or your hair loss, I wouldn't have a clue about how to manage that. And sometimes within your subspecialty in cardiology, I'm particularly good at electrophysiology and syncope, but I'm hopeless, perhaps potentially, at intervention or complex intervention. So if you ask me something about why the stent didn't work and I appear to not give you an answer, it's not because I don't want to, it's because I don't have the knowledge in that subspecialty to give you an answer that is adequate for you. So it might seem that I'm fobbing you off, but that's not the case. I really want you to have the best care by seeing somebody else. So that's number 2. I guess the third thing is to recognize, especially, and this is a bit sensitive, but if you have an expectation of the outcome of the encounter that is unrealistic, but you don't know it, and how would you know it? It's the unknown unknown. You go in there thinking you get a tablet, you get a diagnosis, you get a fix, and you come out underwhelmed, or as you're consulting, you're underwhelmed because you know this is not going anywhere. Again, this could be a mismatch in the ability of the doctor to give you what you need, which is the firm diagnosis and a 3-step management plan that sets you on a way to wellness in a week. Some illnesses, especially chronic illnesses, don't work like that. And again, it comes back to being kind to yourself. Because when you're kind to yourself, it also means that you take the things one day at a time, and you don't have such a high expectation, and therefore with that rate of failure and the constant failures of daily interactions with yourself in life and not really being able to meet that expectation that you set for yourself, really sets you down and sets the mood or that relationship in the clinic room to be starting at a low point. Take whatever positives you can from the encounter. So the doctor is giving you some advice that you know is positive or can make a difference. Don't dismiss it. Listen and try and see their point of view. It is never the case, I would say, that a doctor is out to get you, or the doctor is out to misdiagnose or harm or give you inappropriate medications. This is something that we just don't do. If we do something that doesn't work, it's not malicious, it's out of our ignorance, or because what you have needs multiple things to help. And it's often the case with complex illnesses, which are chronic, that the multiple facets of recovery are sometimes not understood by you or by us. And these multiple facets can include things which are so simple like sleep, breathing, thinking, and acting in a particular way, and lifestyle changes alongside drugs, operations, interventions. And whilst that is a huge number of facets feeding into wellness, we often focus as patients, me included, when I take my parents to the hospital, on those three things, which is the medications, the interventions, the operations. But we forget about the other things that can give us wellness. And the interesting thing there is that these other factors that feed into wellness are within your control. You just need to hear it from the doctor and maybe believe it yourself to put those things in place. And alongside the other interventions that are being offered, often get you a small step forwards in the right direction. And I think coming away from that negative encounter, try and also express those things that we said, but really see yourself whether there can be any positive from the things and the interventions or the measures that have been proposed. Because if you take one step at a time and you feel some small sense of improvement, then you're making progress, and give yourself gratitude and that kind of self-kindness to know that you're making progress. Just to bring it down home, often I get comments because I see a lot of patients in whom I anchor down with syncope or autonomic dysfunction, the basic principles of having water, having more salt if your blood pressure is low, and being mindful about your breath pattern. And if you come away from that clinic appointment, you've come all the way to the Imperial Syncope Clinic for Dr. Boon Lim to tell you to do those three things, you'd feel damn shortchanged, won't you? And this is something that comments sometimes come back to say, I went all the way and all I got was water, salt, and breath. And yet understand that these are the fundamental things that we know can improve our health and well-being. And obviously the easiest thing for us to do in the clinic would be to give you a tablet or to say it's all okay. But the fact that we're taking time and explaining physiology, explaining what you can do, I think should be appreciated. And if you feel that that's not enough, sometimes just trying it for a week or two and then recognizing that that wasn't bad advice, that was actually sound advice, that can color the experience differently for you, and it will change your interaction the next time you come to clinic. Any other thoughts?
Yeah, just going on from that, I think from a patient's point of view, I think sometimes when you go away feeling dissatisfied, it's because you didn't in the moment say, voice your dissatisfaction or voice your confusion or voice something you don't understand. And don't be afraid to say, I don't understand why this you're saying that, you're not going to give me a new medication, but I need to do this. If you don't understand, then ask us. We'd much rather answer that question or help you, guide you in a direction that you could find those answers rather than you leaving dissatisfied. And I know sometimes it can be a bit overwhelming because you're sat there and thinking, they're giving me all this information and I must, but if you don't understand or you're not sure, then please, we'd much rather you in the moment tell us that than leave dissatisfied, because again, that's when you go away and you get even more frustrated in a way. And there are many things which can frustrate you, but as Boone said, I've never met any nurse or doctor that gets up in the morning to think, today I'm going to make somebody's life miserable, today I want to harm somebody. None of us want that, but we are human beings and sometimes we don't express things the way that we should do, or perhaps we're thinking about, we have bereavements, we have upsets, we feel unwell. So sometimes it's just a bad day, a bad moment, a bad interaction. Please do call us up on us and do have some forgiveness for us, but also tell us if you're not happy about something. We'd all much rather try and make you feel better leaving than not.
Thank you both. So in summary, we've got forgiveness for your doctor, gratitude for something about the situation, considering your expectations of the encounter, what you can offer, what you want to bring to it, what your doctor can bring to you, and other aspects that may not be related to the consultation. And fourth, ask and clarify.
And fifth, be positive. I mean, be positive in interactions, because the best way to bring out the best in your doctor is to start off saying, "Good morning, how's your day?"
Yes.
Because that really sets the tone.
And as the patient, you can also set the rapport. It's not. Yes.
Exactly.
Thank you both.